back to another episode of Let's Be Real. I am Tara.
And I'm Sheri.
And we're two Florida LCSWs chatting it up and talking about new stuff today.
Yes.
I like how my intro is just very lackadaisical.
Hey,
You get what you get. We're 50-something episodes in, so you know who we are. And if you don't,
if
you'll
you've been
figure it out very quickly.
Absolutely. If you've been listening, you know how this is how we started off, so it's all good.
Let's be real. Today I'm introducing a topic to Sheri that I don't know if she's been resistant to it or if I just haven't been pushy enough.
I don't really understand it, and I think like when I leave here, I forget about everything. So, at the same time, I hear that word sensitive, and I'm like, really, is that a real thing? So I really want you to explain it to me.
Sure,
teach me.
And I'm not an authority on it. I'm likely to get something wrong here. So fact checkers, compassionate fact checkers are welcome.
Absolutely. Well, and that's the thing is we aren't experts. We work in this field, but we can't know about everything.
No,
so.
And we're constantly learning
Yes.
by law and by choice. So,
exactly.
The topic today is highly sensitive persons or people.
Okay.
It's a concept coined by Dr. Elaine Aron. She's a clinical psychologist. I don't want to go into like a history lesson per se, but she is very much alive practicing. This is a new concept because so many concepts that you and I work with talk about when we're talking about theory, like those people are long gone.
Right, exactly.
So to have new and current theorists and theories and areas of practice, areas of research, I'm really interested in stuff like that. Like we could have probably a whole other episode about like new modalities. Like EMDR is relatively new in the grand scheme of things.
Right.
Ketamine therapy and all of that stuff.
Right.
Psilocybin. So in terms of topics, highly sensitive people is something that's gained a little bit of traction. I think it slowed down recently, but I could be wrong. Anyway, it's just the idea. It's kind of what it sounds like. It's people who are sensitive to stimulus, sensitive to things. But it can be really broad. So, for example, I have the website pulled up, so forgive me if I take some breaks, but I'm going on the self-test website. I'm on hsperson.com. I believe that's Dr. Aron's actual website where she's placed her books, her articles, her research.
Okay.
So there is like a very oversimplified like little inventory. Copyright from 1996. So I don't love that, but we could revisit that, Elaine.
Well, you figure that you have to absolutely let's step it up a little bit here.
We could bring it.
But you figure most have to have a body of work of that long. So
well, I'd like to see that updated.
Yes,
because she's been pointing a lot of this research. But okay, so I'm not going to read the whole inventory, obviously, but I'll give you guys some examples of questions that are asked on here to give you a sense of what could qualify someone to consider themselves highly sensitive.
Okay.
The first one's, I am easily overwhelmed by strong sensory input. Other people's moods affect me. I tend to be very sensitive to pain. I'm particularly sensitive to the effects of caffeine. I have a rich, complex inner life. I am made uncomfortable by loud noises. I'm conscientious. I'm annoyed when people try to get me to do too many things at once. I try hard to avoid making mistakes or forgetting things. I make a point to avoid violent movies and TV shows. Find it unpleasant to have a lot going on at once. When I was a child, my parents or teachers seemed to see me as sensitive or shy. So I don't know about you, but in my life, I definitely have been told that I'm too sensitive. I've been told many times that I take things too seriously. I can't take a joke. And that's another like societal expectation when it's like, I'm trying to make things low. I'm trying to avoid conflict. So now it's a you problem. When it genuinely could be something as simple as, well, I just don't find that funny, or that kind of gets to me a little bit, that overwhelms my systems a little bit. So,
well, that's when you know that there's truth in jest, right? And people try to mask that as funny, as humor.
Yes, exactly. Exactly. It's a competition of values in a sense, right? Like this person doesn't take that seriously. You do want to take it seriously, and now there's potential for conflict.
Right.
So myself, for example, I consider myself to be a sensitive person. This is not a diagnosis, so I am not going to go so far out to say that I'm highly sensitive. I think I admit to being sensitive, which is not something that I see often, especially with independent, strong women or women who, are single mothers, women who own businesses, women who take care of their business or about their business. Being sensitive is seen as a negative thing.
Absolutely. But I think that so many of those same women you talk about are the ones that are sensitive, but they mask it.
Correct. I was a masker. And then sensitivity is not a feminine trait in and of itself.
Right. And so we love to say that. That's very, yes.
Yeah.
Okay.
You're being sensitive. You're being a sissy. You're being use XYZ misogynistic slang terms or insults.
Don't be
right?
a girl. Right.
So it's something that's difficult to study because how many people are actually admitting to being sensitive in the way that I'm describing. This inventory, this quiz makes it pretty straightforward. Right. I'm overwhelmed by loud noises. I avoid violent TV shows. Like those are things that you might be more readily apt to respond to and be honest about.
Right.
But how many men and boys will say that they get annoyed when they're tasked with too much? You guys are problem solvers. You're doers.
Yeah, my 19-year-old son. You just asked me to do that. You told me 10 things, and which one do you want me to actually do? Which a lot of that, and the little bit of knowledge that I do have about this, and from what you just read, that's a lot of ADHD type of
I was
stuff.
just going to conflate that as well. Okay. Especially when it comes to women and ADHD.
Which is seen very differently.
We still don't understand how it's seen, to be quite frank. Like, if a woman is irritable, we just write her off as a bitch.
Right, or she's got her period.
No, I'm containing myself. I don't need to be angry right now.
So there you go, right? But it's true, though. How often do we hear that? Right.
To be a perfectionist, I work very hard to make sure things are as perfect as possible. Is that being highly sensitive or is that female ADHD?
Well, again, I think so much of them are all rolled together, and that's kind of the problem about having to have a diagnosis or label something. But so much is similar between like something on the spectrum, something on, of ADHD.
Yeah.
And so much of the spectrum allows for those. That's why we stopped using Asperger's and why we stopped using certain terms, because we are all on this spectrum.
Yeah.
Right. And well, some people are outside of it, and that's the reason we always have to have something outside of something in order for it to be outside of the norm, right? But the spectrum is not necessarily the norm, and that's why.
Yeah.
But if you look at these things, there are things that so many people feel that way, but we have made those negative things.
Yes.
Right? Nobody can actually take on 12 things at one time.
Right.
And we've made it so that it's seen as you're a great person that can multitask. Well, it's been proven that people can't actually multitask. We can do 5 things at once, but something's suffering.
We can't do 5 things well.
Exactly. Right.
We can't do 2 things well at once.
Right. When I worked at Publix when I was a teenager, from 15 till I was like 22, right? And I worked in the office, like, customer service. And we would be answering the phone, doing a lottery, the lottery machine, selling cigarettes, all at the same time, right? Like 12 things at once. And something was going to get messed up, but you felt like you were like, oh, this awesome, I can do 12 things at once. And at the end of the day, you're like, oh, I wonder why this drawer's short, or I wonder why this didn't get done right, because we can't focus. Or the phone, maybe I sounded like a bitch because I was doing 12 other things.
Yeah.
So I get that. My problem, and the reason why, I guess maybe why I was hesitant, and I have been hesitant to that highly sensitive person, not necessarily diagnosis, like you said, is that gives us another way to not take responsibility. And I'm not saying you're not, right? I'm saying that because there is a way to work with somebody who is ADHD and somebody who has maybe some, autism spectrum features, that if we throw another thing in there, that how do we work with that too without making you now disabled?
Sure. So I like that question. My philosophy is when you find something that works, because a lot of our work is trial and error.
For sure.
Find out if this coping skill works for you. Find out if this parenting skill works for you. See what sticks and then stick it.
Exactly.
So my philosophy is if you have a diagnosis, if you have a method that works for you, I'm not interested in adding to it.
Absolutely.
If I'm diagnosed with ADHD, which I actually am currently researching for myself, if I'm diagnosed with ADHD and I receive treatment, medication, etc. for it, and this inventory that I've taken off of Google is, those things are fairly resolved with that, I don't need to continuously reflect back on my HSP, my highly sensitive person, documentation or literature. That's the word I was looking for. I'll feel a lot more resolved in that. So that's my philosophy, which is it was nice to find that and find a little bit of solace that this is something that's researchable.
Absolutely.
But I don't need to dive into it and make it my whole practice. Right. I like that I can cater to that. And some people are going to have issues with, well, now we're adding more labels. Now we're adding more to do. And I get why that would be annoying when we're talking about autism spectrum, when we're talking about ADHD, when we're talking about other disorders and deficiencies. We don't want to keep tacking on disabilities. We don't want to do that. So to add a label, like something like this, I guess would have the potential to become a diagnosis. I don't like it, but it could become a diagnosis where it really should just be a guidance for how do I take care of myself?
Yes.
Dr. Aron also wrote a book on helping to parent highly sensitive children. If you could pick up a book and learn a method or two, see if it works for your kid, donate the book if it doesn't work, like send it to your library. We're only getting better for doing things like that.
I agree.
If you don't have the capacity to take on those things, I mean, I don't want to preach to parents as a parent of zero, but
you are a child of some of that experienced that, right? And so we went from, I'm going to say, based on the clients that I have now, that people that are in their 60s and 70s are still saying about how their parents did blah, 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 blah.
Yep.
Right?
And I didn't have the language to ask for sensitivity parenting. And I'm not saying it's not the same thing as gentle parenting for anyone who wants to roll it. We're not talking. That's different.
We're just saying to be able to understand each other, right? And the frustration of when you have a child who is crying all the time because their feelings are hurt, and they don't understand your stop crying or I'll smack you, right?
Yes.
Or I'll give you something to cry about, which is really from my generation, right? And maybe people older than me, but they don't, that's not a comfort, right? That's like, oh, but I'm going to keep crying because that sounds even worse, right? It's the idea that kind of shove your feelings down kind of parenting doesn't help us.
Right.
And everybody likes to glorify, well, we didn't coddle our kids back then.
Yeah.
I'm not asking you to coddle your kids. I'm asking to say that, recognizing that it's a little harder for somebody to understand what it is you're trying to say to them.
Your kids don't have language to express what they're feeling.
Exactly.
That's why we start with the whole big feelings, small feelings.
Right.
You start there. And then you add words when their world becomes a little bit bigger and more comprehensible. Right.
And just because you get older doesn't mean you all of a sudden have these skills.
Thank you.
You have to have the skills when you're young in order for them to continue. And if you get stunted somewhere along the way or stuck somewhere, you are literally still there. Right. So that's where trauma therapy comes in.
Yes.
And we're going from those big T's, which we all know as rape and other terrible things have happened, right? But you go to the small T's, which are all that, right? How people dealt with the fact that that you were sensitive to certain statements.
They're not obvious events, right?
Right.
I like how you use the word stunting. So it's things that didn't happen in your development that aren't required to become functional, but they're required to become the best versions of ourselves, right?
Absolutely. Right. So if I'm still in the emotional capacity of 5 years old, I still am an adult. Let's say I'm still 48 years old, but my emotional capacity is when I was 5, right? And that should be able to grow as you get older, but it doesn't when you're stuck there or stunted there.
Yeah. One of the skills I probably coach the most is helping people understand how to say, I don't know what's going on with what I'm feeling right now, but I don't like it and I want to address it. It's just
absolutely right.
If you expect yourself at 25, 35, 45 on to have all of the vocabulary, but you never sat down and studied it, you're going to have a hard time, but you're going to expect yourself to have like this adult vocabulary, this adult abstract understanding, and you're stuck at 5, you're stuck at 7. It's okay to say, I don't like what's happening right now. Something is being threatened emotionally. Something's not feeling right emotionally. I need to take some inventory. So
absolutely,
that's one of these skills I teach is obviously being able to emotionally identify what's going on with you. But if I can't pull out my word wheel right then and there, I can identify that there's something unpleasant happening. We can start there.
Right. Absolutely. Right. And as a child, to be able to have that language is really hard. Right. So for you to be the adult who may not have that language either to handle that is really hard. Right. So if you're an emotionally stunted adult with a highly sensitive child, that's a kind of a recipe for disaster, right? Where that parent is so overwhelmed by the fact that you're still crying about something.
Yes.
And you're still crying about something that we feel is ridiculous. Like, are you freaking kidding me? Like, you're still crying about that pillow like 5 hours later. So being able to say, I understand that this is a hard emotion for you, that this was a hard situation for you. We can feel this, but it's going to be time to move on from this. So I know you're sad, and I'm sorry you're sad. I'm sorry that happened, or whatever it is, to validate that feeling. It's not say cry all night, baby, do what you want, right? Find your voice in that tear, or whatever, whatever bullshit that we might say.
Yeah, but let's figure something that helps you move through it, so we can get through it.
Exactly.
We can get to the other side of it, and then we can feel another emotion that's more pleasant. Let's make room for that.
I love that. I love that. That's perfect. So thank you for explaining that to me so I can understand it better, because it's been said to me in a way of, not by you, but by other people saying, oh, I think so-and-so is this. And I'm like, no, it's not that, it's this, So where people want to use that as, it's easier to have for a child that kind of label per se, than to say you're ADHD and you might have to take medication, because that's really hard for parents to hear.
Exactly.
I don't want to medicate. Well, your kid's a pain in the ass and he needs to be. I'm just kidding. Like the idea is, let's not give them another reason, because this part needs to be taken care of too. So let's put them together. So now I understand we can put them together now that I understand it better. And thank you.
Exactly. So I appreciate that. And it's, I'm a big believer in language as empowerment.
Absolutely.
So if we're adding language like highly sensitive, as much as I agree with you, I don't want to just add to the muddled mess of diagnoses and labels and things that some people can't stand and some people can't get enough of. But I realize that is a problem. But in terms of empowerment, like, this was really helpful for somebody like me. I don't need to make it my platform, but for somebody else, that's a really helpful platform to be seen.
Right.
Same thing when we talk about like sexuality. Like, why does pansexuality have to be a thing? Well, if it matters for one person, what does it do? Like, doesn't get in the way of my day,
Right. Exactly. Well, and I think that goes along with like what I was saying about how we have to label everything. And so there's a fine line, right? When if you want to have a label for yourself and that I can understand that label, that's fine. But you allow making people have to feel that label, if I don't use it correctly, that you're offended or someone's offended.
Oh,
like, if I don't understand it, please educate me, as opposed to making me feel bad about it. Right.
Well, that's a nice perspective for folks that are ready to hear that.
Agreed.
Because there's people that will still use sensitive as an insult.
Exactly. And I think that's another, right? Why are you so sensitive? Because are those the same people who have been hearing that their whole lives?
Yes.
Or, right? Or I don't know why, like I have people come in my office and say, I don't know why I'm crying. And I'm like, girl, you're allowed to cry here.
Yes.
Or man, or sir, you're allowed to cry here. Whatever. This is what you come here for. I mean, not just to cry, but
if you can't feel that here,
right?
Where are you allowed to?
Right. And why are you apologizing to me?
Oh yeah.
Well, I get a lot of that. Like, I'm like, wait a minute. If you can't cry in front of your therapist, who are you going to cry in front of? Like, that's who else is supposed to be the one to handle that?
Exactly.
And I'm okay with it because that's a hard emotion for you, and that's what we're working on.
Yeah, vulnerability, sensitivity. And sensitivity by itself is just a word that talks about people's perception of their environment.
Absolutely.
That's all it means. There's highly sensitive, where I'm very aware of what's going on, which is why I'm affected by other people's emotions. Some people says that makes me an empath, and maybe it does, but I'll be honest, I don't fully understand the difference between those things.
I honestly don't either.
They're too nuanced for me, and I've got enough on my reading list. Thank you.
Well, but like that intuitive way, right? And I think just because you're intuitive or you're aware doesn't necessarily mean you're an empath, but I don't really even understand that fully either. But
it also doesn't make me highly sensitive. It makes me sensitive to what others are experiencing, which I have an argument makes me pretty good at my job.
Absolutely. Right. You're very aware of others. Right. But so those are like in my practice, like if you were to look at my bio, everything says that I look for strengths like that. I believe that we have to have strength. Everybody has them, and it's our job to use them, right? It's a gift we've been given, and it's your responsibility to use them, right? So everybody has that in you, and we forget that. But if I look at, you can look at anything as a strength or a weakness. So you can flip anything over. Yes. So if you say, I see sensitivity as a weakness, well, but absolutely it's a strength, right? So and being aware of what's happening around you is a strength. But when it becomes, nothing's a problem until it's a problem, right? If it's too much, it's too much. So learning to rein some of that in and saying, no, doesn't mean that there's something wrong with me. It just means that I need to learn how to attune to it better,
right? Or
be less attuned to it. So, and that's why those being highly sensitive to sounds, like I'm a loud person. If y'all haven't noticed, right? I'm a loud person. I don't know how to be the one in the morning that's quiet. My sister can attain to that. She's the one that wakes up and no one would know she's awake and could be out the door and no one knew she left. I'm good morning and everyone's like ready to kill me. And I just don't know how to get up and not be that way.
Sure.
But then, so everybody has a certain way about them and we can't change that part of us. We can just figure out how to make it more or less adaptable to what we need it to be.
Yeah.
Exactly. So I think it's about learning how to adapt.
I agree. And
in a good way, not to morph into something that you're not.
No, we don't need to fit ourselves into round holes if we're square pegs. We don't need to be doing all that. You don't need to shave yourself down for anything.
Right.
It's adapting to your environment to make yourself functional and thriving to the best of our ability.
Absolutely. That's all we're trying to do is get through this life,
So this could be a whole other episode, but I do want to make a connection into because you use the word adapting is the idea of highly sensitive people and the way we diagnose ADHD, the way we understand autism. Are these responses to the way that we're changing as well?
Probably.
Right?
Makes sense.
Talking about multitasking. We are in this era of hyper productivity.
And we need to get the hell out of it.
I argue it's toxic. It's horrible. I don't enjoy telling my clients that what they've trained themselves to do is too much.
I tell mine all the time.
I don't like telling them that. I don't enjoy.
Why don't you like to?
Well, it's the reality, but
yeah,
it's also this hamster wheel of corporate America, of capitalism, of the system that feeds itself by exploiting us as workers, exploiting us as people. We just keep feeding this machine where, our boss's boss benefits. I mean, you and I work for ourselves, so that's fantastic. But
Right, but I still have to kill myself at the end of the day in order to make make what I need to make, right? Because when I go on vacation, I don't get paid, right? So it's the same.
Well, that's the
chain. What's the word? That's what I'm giving up in order the exchange, right? So I agree, right? And somewhere I think that shifting though, right, with your generation. And
well, because we're saying no,
right?
And the younger millennials.
Thank you for saying
Gen
that.
Z is really carrying the weight of this. Millennials are like, we're just gonna laugh about it, or we'll cry, and we're just, we were told to get degrees, and we'll have the life we've always imagined,
right? Which they lied to you, and then, but at the same time, like being able to say that, yeah, that works if you need it for this, right? But if you're not going to need it for that, then you don't have to have it. It's okay. Go do something else, right? But the idea is that my parents' generation, or maybe the ones before, I'm not sure of timeline, but that they are the ones that came up with that 40-hour week that said, oh, hell no, we're not going to work ourselves totally to death.
Yep.
But then they also said, okay, you're going to have to pay time and a half, and we're going to have to do that if you go over, right? So thank you very much for that. But now we're also realizing that 40 hours is really too much too, right?
40 hours was reasonable when one person in a married household could carry everything.
Right. But even then it wasn't really, nobody really still worked that somehow, right? Because, and having to keep that, if you're the guy, because that's how it was, right? If you're the man that's working all those hours and you come home and now everybody's either eating dinner or ready to eat dinner, and now you have to go and start it all over again in the morning, right? You don't get to have that balance with your family.
Yeah.
Where, let's say, mom got all the balance or too much, right? She got too much of the time with the kids during the day.
Sure.
Right? So where does the balance come? Where do we get this? We talk about this work-life balance. Does that really exist?
Not right now.
Right. So that's kind of our goal, I think. That's where thank goodness the remote working has taken on more, which is harder. I can't do it, but I mean, I could technically. I know you're doing it.
You don't prefer it.
I don't prefer it,
and
because at the end of the day, I would probably scream and run into a wall. But I need to be with people. I need to be out, and I need to be in a setting that tells me this is what you're supposed to be doing.
Yeah.
Otherwise, I find other things, and the bed calls. So, or the couch, right?
Yeah.
And I don't want to be that person, the shark we talked about, right? Did we clarify that you found that the shark?
Did.
Yes, we did. Okay, good. Yeah. So anyway, on that note, we will move forward and continue to send us ideas. I know that people were wanting to know about this highly sensitive person.
Yeah.
And Sherry's been pushing it off. But thank you very much.
No, I know I sounded like I was blaming you. That's not fair.
But it's true. You were. I mean, you weren't. I'm sorry. You were. And it was true for you to blame me, because I was like, I don't know.
But I said resistant, and hesitant is a better word.
Yeah. So. I have had people ask me to talk about moral injury. So maybe that's something we'll talk about in another episode. Because I don't understand it enough, but I've been given stuff to be able to understand.
Yeah, we have that email from one of our listeners that we can definitely review.
Yeah,
and because I could afford to do some more research on it.
Yeah.
But our moral injury episode is going to be less informed than this one. Yeah. But it'll be very curious.
Yeah, absolutely. But if anybody has anything else they want to add to that, or would like to be a guest on that, help us to understand that. Yeah.
I would appreciate that, actually. And especially with HSP and sensitivity, any feedback is welcome on that, because I am not the voice for HSP. As you heard, I was back and forth. Well, not back and forth, but I was suggesting that I'm moving away. I'm just accepting that I'm sensitive.
Yeah.
And that works for me. I'm reclaiming that. That's empowerment for me.
Absolutely.
Just like the word selfish I've talked about before. I am sensitive. I am selfish. I am she. She is me. It is fantastic.
Yes.
But you can't use it as an insult for me, and that's kind of where that was coming from. And it helps understand my childhood. It helps understand.
It takes that voice out and puts yours in. I like it.
I like that too.
Good.
Well, as always, links in bio, links in our episode description. If you're watching on YouTube, please subscribe, share this with a bunch of people, annoy people with it. You haven't talked to people since New Year's and Christmas, so go ahead and send it to them.
That's right. Share away, please.
But we appreciate y'all for listening every week, and we'll see you next time.
Bye-bye.
Bye.